How you mean you wash your hands? Hey, you violent, my boy. Well, every time that you get a chance, you have to wash up your hands. Put on your mask, practice some distance, stop spread corona. Like, it's Adamo. And on behalf of the Virgin Islands Department of Health, hold it down on all the mass gatherings. Wearing a mask not only protects you, but it protects your loved ones and your community. Like, help stop the spread corona.
Welcome to the Virgin Islands. Oh na na, oh na na na. Reconnect with paradise. The VI slides with me, with the emeralds of the seas. The Virgin Islands, they are calling out to me. The VI slides with me, with the emeralds of the seas. The Virgin Islands, they are calling out to me.
As a teacher, I did my part and took the COVID-19 vaccine to help combat the pandemic. The Pfizer and Moderna vaccines are here in the USVI and they are safe. But we still need to wear our masks, wash our hands, and practice social distancing so we can achieve herd immunity.
Can I have 2 fried chicken legs, 4 Johnny cake, and a rum and coke? Or and 2 slices of chocolate cake, 1 for now and 1 for later.
Nadia, you really gonna eat all of that? You need to make better food choices. Heart disease runs in our family. Grandma got high blood pressure and Uncle Billy just had a stroke.
Well, I'm young and I don't exercise 2 days a week.
That is not enough.
Managing heart disease might be difficult, but with better choices and healthier living, we can get through it. Avoid overeating. A balanced diet in the right proportions can reduce the risk of heart disease. Exercise at least 30 minutes per day, 3 times a week. Make it a lifestyle. Virgin Islands Vital Statistics data shows that heart disease is one of the leading causes of death in the territory. For more ways you can reduce the risk of heart disease, visit the DOH office today.
Good day, and welcome to the Government House Weekly Press Briefing and COVID-19 Update for the week of February 1st, 2021. My name is Richard Mota. I am Government House Communications Director. Today is the first day of Black History Month, and I would like to wish you all a happy Black History Month and encourage you to take some time not only to celebrate, but also to reflect on the toils, the accomplishments, and the stories told of our ancestors. I also want us to remember that their struggles are today just as relevant to the fruits with which we hope to feed our future generations. And so that is why we should celebrate Black history and our Virgin Islands history daily, and not just during the months of February and March. As usual, in the interest of transparency, we are here to provide critical information on what is happening in the prior week and what is happening in the week ahead within the Bryan Roach administration and our territory's continued response to the coronavirus. Hopefully, you can share that information with those who are unable to join us live. If you cannot join us live on Mondays at 1 p.m., you can always watch the briefings on our Facebook page at facebook.com/Government House USVI, on our YouTube page at youtube.com/Government House USVI, and on the Government Access channel, which is channel 27, if you have VIA. Joining me this afternoon to provide the latest on our COVID-19 statistics and vaccination process is Health Commissioner Justa Encarnacion, along with FITEMA Director Daryl Joshin, who is announcing our new vaccine information hotline. So without further delay, I will turn over this afternoon's briefing to Health Commissioner Encarnacion. Commissioner.
Thank you. Good afternoon, Director Mota, and those of you looking and listening. It's a pleasure to be here with you today. As of January 30th, 2021, there have been a total of 41,968 persons under investigation, or PUIs, of which 2,421 have tested positive, 39,454 have tested negative. There are currently 91 active cases in the territory. 2,306 cases have recovered, with 24 fatalities related to COVID-19. Our weekly positivity rate is 4.1%. We did see some improvements, but with new cases seen throughout the territory, our positivity rate fluctuates. We experienced an increase in hospitalization last week, with as many as 6 cases in the territory all at once. Currently, we have 1 person hospitalized in each district. Good news. This indicates that as new cases persist, there is a potential for more people to experience severe illnesses. This also reminds us to adhere to our guidelines. If you are experiencing COVID-19 symptoms or suspect that you may be sick, please call the epidemiology hotline at 340-712-6299 or 340-776-1519. We are also making testing easier by hosting testing events at various locations. Our upcoming pop-up test events are St. Thomas at Home Depot, Tuesday, February 2nd, tomorrow from 1 p.m. and 3 p.m., and St. Thomas at Bordeaux Fire Station, Thursday, that's February 4th, from 1 p.m. to 3 p.m. St. Croix at the Canigata Recreation Center, Tuesdays, February 2nd, February 9th, February 16th, and 23rd from 10 a.m. to 1 p.m., and Thursdays, February 4th, 11th, 18th, and 25th from 10 a.m. to 1 p.m. In St. John at the VI Port Authority Gravel Yard, Wednesday, February 3rd from 1:30 p.m. to 4:40 p.m. As we schedule more testing sites in St. John, we will let you know. I encourage you to avoid non-essential travel, practice physical distancing, wash your hands frequently with soap and water, and if you're eligible for COVID-19 vaccines, please take advantage of that opportunity and get vaccinated. The Department of Health continues to push forward in the COVID-19 fight. Since December 16th, with the support of our federal and local partners, our vaccinating providers, and our community, we have been able to administer 9,429 vaccines with 1,815 completed second doses. Together, we continue to work hard to bring Pfizer and Moderna vaccines to as many people as possible to eventually achieve herd immunity. We are currently vaccinating individuals in phases 1A and 1B of our phase-based vaccination plan. We have vaccinated senior citizens, teachers, EMTs, persons with end-stage renal disease, police officers, nurses, and many more across the territory. The start of phase 1B does not indicate the end of phase 1A. The phases do not have hard stops or starts or stop and can occur simultaneously. For instance, a police officer and a senior citizen can both receive the vaccine at the same time. We are all in this together. We are continuing to order and receive vaccines regularly and will advance our phases based on guidance from the Advisory Committee on Immunization Practices, or ACIP, and based on the vaccines available in the territory. The territory received 900 additional Moderna vaccine doses through the Biden-Harris administration as part of the national effort to increase the amount of vaccine available to every jurisdiction. The next vaccination phase is 1C and includes individuals who work in water and waste management, food services, shelters and housing, finance, information technology and communications, energy, legal, and media, with a continuation of those not vaccinated in phases 1A and 1B. Phases 2 and 3 encompass the wider public, starting with those in prior phases who have not been vaccinated, and then the rest of the wider public. The Department of Health Community Health Clinic, the federally qualified health centers, and the private providers on St. Croix, St. Thomas, and St. John are vaccinating individuals identified in phases 1A and 1B by appointment. The good news is so many of you are asking to be vaccinated. With the high demand, we ask that eligible persons be patient when making an appointment for the vaccine. We promise we will get to you. We have been fielding lots of questions surrounding the cost of the vaccine. There is no out-of-pocket cost for COVID-19 vaccine. According to the CDC, vaccine doses purchased by the United States taxpayer dollars will be given to the American people at no cost. However, vaccination providers can charge an administration fee for giving someone the shot. Vaccination providers can be reimbursed for this by the patient's public or private insurance company, or for uninsured patients by the Health Resources and Services Administration's Provider Relief Fund. No one can be denied a vaccine if they are unable to pay the vaccination administration fee. To find out if you're eligible to receive the vaccine and for a list of providers administering the vaccine, please visit covid19usvi.com/vaccines. Once you receive the vaccine, it's important to sign up or assist others in signing up for vSafe, an electronic tool that will allow us to collect and track data on any reactions that may occur. This helps you and it helps us. More information on vSafe can be found on our new COVID-19 webpage at covid19usvi.com/vaccines. I am grateful for the way we have been able to collaborate with the providers during the rollout, and even more exciting in the community's willingness to receive the vaccine that has truly made me optimistic about reaching our goal of obtaining herd immunity and saying goodbye to the COVID-19 pandemic. A quick reminder to be mindful and appreciate what you can do to help others and help yourself. With that, I turn it back over to you, Director Mota. Thank you.
Thank you, Commissioner. I know there are a lot of questions from the public with respect to the vaccine, and so we have with us this afternoon Director Darrell Joshin from the Virgin Islands Territorial Emergency Management Agency to talk about a new and exciting initiative that we have put forward, and that is a hotline for information on the COVID-19 vaccine. Director Joshin.
All right, thank you, Director Mota, and thank you, Commissioner Encarnacion, for your updates. Similar to what you talked about, I'll probably refresh some of those things to make sure we're in sync on it. So again, I'm Darrell D. Joshin. I'm Director of the Virgin Islands Territorial Emergency Management Agency. I'd like to spend some time today discussing the role VITEMA is taking on to assist the Department of Health and the territorial healthcare providers in serving as a case manager for scheduling individual appointments for the first dose the COVID-19 vaccination beginning tomorrow Tuesday, February 2nd, 2021. The background for taking on this role for COVID-19 case manager goes back to the feedback received by the Department of Health from the providers once the territory opened up the COVID-19 vaccine and what was termed the frontline essential workers, plus other critical at-risk individuals going back to December 28th, 2020. And this phase is known as 1B, or I call it 1 Bravo. This phase represents a significant increase in the eligibility of the COVID-19 vaccine, in addition to the phase 1 Alpha, which was healthcare workers, EMS workers, dialysis patients, long-term care facility, and residents. Currently, like the Commissioner said, we're still in phase 1 and in phase 1 Alpha and Bravo, and we have additional 28-plus providers who are quickly overwhelmed by individuals wanting the vaccine. This is a tremendous, wonderful challenge to have, and after having the discussions, we're looking at what we can do to help improve that, getting information out and about. So now phase 1 Bravo does include age 65 plus, college-age students, restaurant workers, grocery store workers, hotel and casino workers, plus 28 local and federal agencies. Now, once phase 1 Charlie begins, 1C, that date's not been determined yet, like the Commissioner said. It will also include phase 1 Alpha and 1 Bravo, plus we'll add retail workers on an additional 11 government and federal workers or agencies. And at phase 2, a date again to be determined, we'll have additional local government federal agencies. So you can see sort of the exponential effect as each phase adds more and more population to eligibility for this. All of these phases right now are being accomplished with no additional staffing by the providers, plus limited to same vaccine allocation since the beginning way back in October 16, 2020. So if you can show the slide as far as the next step forward that my team is taking on, beginning again tomorrow, February 2nd, 2021, for those healthcare providers, again, not all of them have come back to us. We have 12 of them currently. For any individual who wants an appointment to get the vaccine, to contact VITEMA. And the key number, only one number to call, 340-777-VAX, which is 8227. Again, 340-777-VACS, 8227. Or you can visit our VITEMA website, the main website most individuals know, www.vitema.vi.gov, to schedule an appointment. The phone number will be staffed Monday through Friday from 8:30 to 3 o'clock. And after 3 o'clock, then we start the coordination with the providers to make sure the appointments can be scheduled. Both we have English and Spanish-speaking individuals available when you call in, as well as our website has English and Spanish translations in the form to complete. So if you have some challenges, please visit the website and call in to help me get some information for you. After VITEMA gathers the information, once your phone number or from the website submission, will contact you back with your appointment details. The information to be placed in our contact database. In some cases, you may not be eligible quite yet, but we want you to call. If you're interested in the vaccine, give us a call, and we will put you in the queue, identify you, call you back when you're eligible to get that vaccine. Of course, let us know which island you are on that you want to receive the vaccine. Very important for us to schedule that. We do have an after-hours message for the voicemail. You can leave it in VITEMA, and we'll post return it back as soon as you can. Please use your name, your island you're on, that you want to see the vaccine, and a contact number. Now, like Commissioner Carcion said, both insured and uninsured individuals are eligible for the vaccine, and no provider is permitted to request any what's called out-of-pocket cost or ask you for individual reimbursement. Of course, your insurance company or the provider can go back and seek the reimbursement through the federal government separately. Also, again, age 65 and plus is encouraged to call. We can help schedule this for you and make this a one-stop shop for you to get your vaccine appointment. If you're a veteran, age 55 plus, you're eligible for COVID-19 through the Department of Veterans Affairs. And you can either call the VITEMA hotline, and we'll put you in contact with them. Again, 340-777-VAX, which is 8227, or schedule directly with the VA at the following number, which is 787-641-4591. Again, for the VA directly for a COVID-19 vaccine, if you're age 55 plus and you're a veteran, 787-641-4591. We've already done one successful Veterans Affairs vaccination on St. Croix, and we're looking at here next couple of weeks going to St. Thomas. So please reach out to Director Farrell and his staff and that number to get some details on that. For all individuals, your second dose for the COVID-19 vaccine will be scheduled through your first vaccine provider, so you don't have to come back to my team at all. You don't need to ask for any more details. It will provide information to you. You will get a little card indicates when you come back for your second vaccination. If you happen to have the Pfizer, the second dose is administered within 21 days of the first dose. If you have Moderna, it's within 28 days of your first dose. I can tell you, my team is honored and partnered with Department of Health and our territorial healthcare providers to provide this important service to you. With our desire to follow Governor Bryan's mandate to get shots in arms as quickly and efficiently as possible. So thank you very much. Back to you, Director Mota.
Thank you, Director Joshin. So we have two updates related to our COVID-19 assistance programs. One from the Virgin Islands Department of Labor. As of this morning, the Department of Labor has issued 52,908 unemployment insurance checks totaling $43.5 million to Virgin Islands residents impacted by COVID-19 related job losses. They have also issued another 29,348 pandemic unemployment compensation payments totaling just over $50 million. In addition, the department has issued 7,888 pandemic unemployment assistance checks totaling $13.1 million and $6.2 million in pandemic emergency unemployment compensation payments. Under the newly administered Lost Wage Assistance Program, the department has issued approximately 3,548 checks totaling just under $3 million. To apply for unemployment insurance, visit the department's website at vidol.gov, or you can visit their offices in Estate Sign Farm in St. Croix and at Estate Contant in St. Thomas on Tuesdays, Wednesdays, and Thursdays. We have some good news for the public concerning the second CARES Act stimulus. The Bureau of Internal Revenue expects to begin the rollout of the second economic impact payments, commonly referred to as stimulus checks, in the amount of $600 per taxpayer and $600 per dependent who is age 16 or younger, starting the second week of this month. Based on the COVID-related Tax Relief Act of 2020, the second stimulus check will be based on the 2019 income tax return, and as such, the tax year 2018 information cannot be used. I will repeat that. Based on the new bill in Congress, the second stimulus check will be based on your 2019 income tax return and not the 2018 tax return. For those taxpayers who have already filed their 2019 tax returns, there is nothing else that you need to do. For those of you who have worked in 2019 and have not filed your 2019 tax return, you are urged to do so immediately. For those Social Security recipients who do not have a filing requirement, there is no need to file a return. The Bureau already has your information from the last payment of those stimulus checks. For those taxpayers who did not work in 2019 and do not file a return, you are asked to file a Form 1040 for 2019 and place $1 on the interest line. Again, if you have not worked in 2019 and you do not normally file an income tax return, you are being asked to file a Form 1040 and place $1 on the interest line. Due to the time constraints on paying the second stimulus checks, these non-filer taxpayers are required to file their returns no later than Monday, March 15th, 2021 to receive their second stimulus check as soon as possible. I will repeat that. If you have not filed your 2019 income tax, or if you're a non-filer and you need to file your Form 1040, you have until Monday, March 15th to be able to do that in order to be eligible for the second stimulus payment. And you can go to the Bureau of Internal Revenue to be able to do that. Taxpayers who did not get the first stimulus checks, you are reminded that you will be able to receive the payment on the Form 1040 for 2020, which is due on April 15th, 2021. If you have any questions about the second stimulus check, please call the Office of or the Bureau of Internal Revenue at 340-715-1040. And their extension there will be 2249, and that is the Office of Chief Counsel for that specific information. I will repeat that number. It is area code 340, and the number is 715-1040, and the extension is 2249. In non-COVID related news, as the governor forecast in his State of the Territory address last week, Limetree Bay is announcing today that it has officially commenced refinery operations at the refinery in St. Croix. Governor Bryan, in a statement, called the news a big victory for St. Croix and the U.S. Virgin Islands, and noted that he looked forward to the refinery creating hundreds of well-paying quality jobs for USVI workers, and also toward the successful continuation of the public-private partnership between Limetree and the Virgin Islands government. In what I am sure is welcome news to many as we close this afternoon, Governor Bryan has ordered an extension to the hours for alcohol sales and the operating hours of bars and restaurant establishments for Super Bowl Sunday. Effective only on Sunday, February 7th, from 11 p.m. to 12 a.m., bar and restaurant establishments will be allowed to sell alcohol to patrons. This essentially means that on Super Bowl Sunday and Super Bowl Sunday only, bars and restaurants are allowed to sell alcohol for 1 additional hour past the 11 p.m. sales prohibition. I will repeat that. Super Bowl Sunday only, bars and restaurants are allowed to sell alcohol for 1 additional hour past the 11 p.m. sales prohibition. Also effective only on Super Bowl Sunday, which is Sunday, February 7th, bar and restaurant establishments are also allowed to remain open until 1 a.m. So that's an additional hour for alcohol sales and an additional hour to remain open to close out those operations. So that's the news that we have for you this afternoon. We will take any questions from the media if there are any. Hearing none, I would like to thank you again for your time joining us this afternoon, and like to welcome you to continue joining us every Monday at 1 p.m. unless otherwise notified. Thank you for your time. Thank you for your attention. Stay safe.